Difference between fibrillation and flutter. Look at this picture, ECG finding normal and fibrillation, flutter, arterial flutter. Look at this. A detail going on. Fibrillation, a rapid, chaotic and irregular contraction of muscle fibers, especially in the heart, where no coordinated pumping occurs. Flutter, a rapid but organized and regular rhythm, usually forming a repeated electrical circuit. Difference between one, electrical activity pattern, fibrillation, disorganized electrical impulse, firing randomly across the tissue. But flutter, a single retrained circuit, creates a predictable cycle electrical pattern. 2. Rhythm regularity. Fibrillation, irregular rhythm, no pattern at all. But flutter, regular rhythm, consistent intervals between beats. Three, heart rate characteristics. Fibrillation, very rapid and variable heart rate. Example, arterial fibrillation varies beat to beat. But flutter, fast but usually fixed rate, commonly around 250 to 350 bpm in arterial flutter. Four, coordination of muscle contraction. Fibrillation, no effective contraction, muscle fiber cure. But flutter, partial coordination, there is still some organized contraction. 5. Pumping efficiency. Fibrillation, highly inefficient and completely stop effective blood circulation, especially ventricular fibrillation. Flutter, reduced efficiency but still capable of pumping blood, especially arterial flutter. Six, ECG appearance. Fibrillation, irregular baseline with no distinct waves. Example, no clear P waves in arterial fibrillation. But flutter characteristics, sawtooth pattern, especially in arterial flutter. 7. Underlying mechanism. Fibrillation, multiple wandering wavelets of electrical activity, but flutter, single large retrained loop. 8. Severity and risk. Fibrillation, often more dangerous. Ventricular fibrillation is life-threatening, but flutter usually less immediately dangerous but still serious. 9. Example: fibrillation, arterial fibrillation, ventricular fibrillation, flutter, arterial flutter. 10. Response to treatment: fibrillation may require urgent defibrillation, especially ventricular fibrillation. Flutter often responds well to medications or cardioversion. 11. Blood clot risk: fibrillation high risk due to stagnant blood flow, especially in arterial fibrillation. Flutter risk present but generally low compared to fibrillation. 12. Symptoms: fibrillation, palpitations, dizziness, fatigue or sudden collapse in severe cases, but in flutter, palpitations, mild dizziness or shortness of breath. 13. Stability of rhythm: fibrillation highly unstable and unpredictable, but flutter more stable and predictable pattern. 14. Conversation between condition: fibrillation may arise from flutter or existing independently, but flutter can sometimes progress into fibrillation. Thank you. Have a nice day.